Today, I am Carissa Pablo, the student nurse. So for today, I will be doing the shampooing of hair. So first, I will review the patient's chart for any activity limitations or contraindictions before starting the procedure, because this helps prevent the patient discomfort and injury. And next, I will now perform hand hygiene and wear appropriate PPE if needed, because this prevents the spread of microorganisms and follows the transmission's precautions. But before that, I'll remove my watch first. And I will now perform hand hygiene. And next, I will identify the patient and explain the procedure. Good day, ma'am. I am Carissa Pablo, your student nurse for today. May I know your full name, ma'am?
Ashley Rain Sapurco,
Your birthday?
November 11, 2007,
And your age po?
18 years old.
Okay, ma'am. I will verify your identity by checking your ID band. May I see your ID band, ma'am? Okay, ma'am. Thank you. So for today, ma'am, I will shampoo your hair while you remain in bed. And if you feel uncomfortable at any time, please let me know. And correct identifying of patient and procedure reduces anxiety and prepares the patient. Next, I will gather all the needed equipment and place them on the overbed table with the patient reach, and such as the shampoo board, the protective pad, gloves, towels, and of course shampoo and water. This keeps the procedure organized and efficient. And I will now close the curtains for the patient's privacy. And next, I will lower the head of the bed and remove the pillow. Ma'am, I will remove your pillow po. Can you lift your head po, please? Ma'am. And place a protective pad under the patient's head and shoulders. Ma'am, can you lift your head again, ma'am? Okay, ma'am. And next, I already fill the pitcher with warm water. I will now position the patient at the top of the bed and in a supine position. And ask the patient to lift the head, and I will place the shampoo board underneath and pad edge with the towel if needed. Ma'am, I will now position you in a supine position po. I will also put the shampoo board, ma'am. And I will now place the pad edge with the towel if needed. Because warm water is relaxing, improves cleaning and circulation, and padding increases comfort. And next, I will place the drain container under the shampoo board. This collects the runoff water and keeps the floor dry. Next, I will now put on gloves to prevent infections. But in this procedure, we will not use gloves because it is not necessary. I mean, it is not usually necessary. Next, ma'am, I will fold the washcloth po, and can you hold this one, ma'am? Can you hold this one, ma'am? Okay, thank you. Because the washcloth keeps the water out of eyes. And I will now slowly pull the water over the hair. I will now pull the water down. Are you ready? also refill the pitcher if it's run out of water. And now I will apply the small amount of shampoo and gently massage the scalp because shampoo removes dirt and oil. I will apply shampoo na po, ma'am. Massage your head, ma'am. And next, I will rinse the hair with warm water until the shampoo is removed. I will rinse it na po, ma'am. First drain the water po. And rinse again, ma'am. And I will repeat the shampoo if needed. But in my patient case, she don't need that because her hair is already clean. And removing all shampoo prevents itching, and repeating may be needed if the hair is still dirty. And take note, if the patient has thick hair or requests it, you can apply conditioner and gently massage it through the hair while avoid hair tangles because conditioner helps remove tangles and moisturize the hair and scalp. Next, if the drain container is full, I will empty it before rinsing. Then, if you use conditioner to your patient, you will rinse the conditioner completely with warm water, because this prevents overflow and itching from leftover conditioner. Next, I will remove the shampoo board and wrap a towel around the patient's hair. This helps keep the patient warm. I'll now remove this shampoo board. Place the towel. And I will gently pat dry and avoiding any cuts or sore areas. Then I will remove the protective pad. Hold this po. I will now remove your protective pad now. Thank you. And leave one dry pad under the patient's hair. And because patting the hair dry removes excess water without damaging the hair or scalp. And I will gently brush now the hair and remove any tangles. I will now brush your hair, ma'am. Because this helps the hair dry faster and improves the patient's self-image. And if allowed, the patient If allowed and the patient agrees, I will blow dry the hair using a cool setting. If not, I will cover the hair with a dry towel until it dries. What do you prefer, ma'am? Blow dry or towel po?
Towel.
Okay, ma'am. This helps the hair dry faster and prevents the patient from becoming cold. And I will now change the patient gown if it's damp and remove the protective pad and replace the pillow to keep the patient warm and comfortable. I will now replace your pillow po. Can you lift your head po? And I will remove the equipment position the patient comfortably and remove my gloves if I use gloves and raise side rail and lower the bed. I will now position the client first. Ma'am, what's your preferred comfortable position po? Ma'am, I'll now lower the bed and side rails. And this promotes patient comfort and safety while reducing the risk of infection. And lastly, I will remove any remaining PPE and perform hand hygiene. This prevents the spread of microorganisms and completes the procedure safely. I will now perform hand hygiene. But before that, I will remove the washcloth first for my patient. Perform hand hygiene. And that's all for the shampooing of hair. And thank you for watching.